Luis Margaliesh, the soloist, and the Symphony No. 5 by Prokofiev. And we at SAFM will be recording as usual. That's on Thursday evening, the 25th of November, in the City Hall in Cape Town. The starting time is 8 o'clock, and you book at CompuTicket.
Otherwise on SAFM.
Otherwise it is coming to you from sunny Derbs, or perhaps not so sunny Derbs, but certainly Derbs anyway, and it's lovely to be here. Well, Helen Ziller kind of made it famous, and there are some people who wouldn't even entertain having it. And in case you're wondering what I'm talking about, it is Botox. So what is it, and what does it really do for you? Well, Dr Maureen Allem is an aesthetician who recommends it as a way of looking younger. I don't have her in front of me, so I can't tell you how it has worked for her, but we do have her on the line. She's from the Skin and Body Renewal Centre in the Operation Joburg, Cape Town and Pretoria, and we got her on the line to tell us a little bit more about it. Maureen, are you there?
Hi, Nancy.
Hi, lovely to have you with us. A little bit of feedback there. I'm not sure if you can hear me all right. Can you hear me okay, Maureen?
No problem.
Good, good. Maureen, how and why did you get into Botox yourself?
You know, about 10 years ago, I kept reading about this treatment that could relax the frown lines between the brows. And I found myself and my daughter, from the age of 3, has been frowning badly. And my sisters all frown. I have quite a few of them. So about 10 years ago, we all toddled off to a plastic surgeon to have this new, Botox treatment. And after having the treatment myself, I realized what an amazing treatment it was. Because it made you look less anxious, and it gave you more, when a person... First time a person actually sees you, your appearances count a lot. So if you look anxious or you look cross, this is what Botox does. It just makes you look more approachable.
Yeah. You say it's as a result of frowning. Well, we all frown. Some of us frown more than others, depending on what's going on. Is it not a sort of a natural process of aging that you all get the few sort of, what do they call them, crow's feet around the eyes?
Absolutely. When you're young and your skin is full of collagen, you don't actually get those permanent lines. But with time, from losing collagen and sun damage, eventually from continual frowning, this is called dynamic frowning, dynamic wrinkles, we eventually get those two, like 11, we call them the 11s, in the middle of the brow. And very often they also appear on the horizontal brow. And those, with time, even though you're not frowning, you still have those frown lines. And that's where Botox helps a lot. Botox helps dramatically there on the forehead.
So it helps you look not so anxious. But, we've heard that it also can make you look quite static. I mean, part of I can't remember who it is that says that a woman's life is written on her face. It's a natural thing to show expression and emotion. Does Botox not sort of, as it were, like freeze your face?
You see, that's the trick. You get the exact right amount, and in the exact right that you don't get that frozen look. So you have to have a very natural look so that you can still move your brows, but you don't have that hectic frowning that occurs in the middle. So it just depends exactly, how many units of Botox you put, and exactly where you put the Botox that makes the difference.
Is it reversible?
Look, with time it is reversible. Every Botox treatment after like 3-4 months, your nerves regain that transmission to the nerves. So it's completely reversible. That's the beauty about Botox. And if you don't like the effect that Botox gives you, you just have to wait a few months and then the Botox goes away.
It's a very your face is a very sensitive place. I mean, it's what, as you say quite rightly, it's first impressions are made. Do people use it on other areas of the body, or is it just a facial thing?
No, absolutely. I mean, Botox is a miracle drug in medicine. There are many numerous medical conditions that are used for Botox. I mean, it started off with blepharospasm, which is a continual spasm of the eye that eventually gets so bad that you cannot...
Is that like, do you mean like a nervous tick?
On the eye, that eventually it's so bad that you are like functionally blind. And that's how they recognized Botox, I think 12, 13 years ago, where the ophthalmologist was injecting around the eye. And then the patient came back and said, doctor, because only the one eye was done, and she said, that my wrinkles actually are much less on this eye. And then her husband happened to be a dermatologist. So between the two of them, they collaborated to actually get the best dose to see exactly what it would do around the eyes, and then they started to work on the frown lines, and that's how Botox came about.
How long ago was that, and what sort of tests have been done on women who've had Botox done? Have there been any sort of side effects, long-term damage?
No, look, Botox is one of the most widely researched and peer-reviewed clinical trials that we've done, and all these trials can attest to the safety of Botox. I don't think there's ever been a death attributed to Botox.
Yeah.
Sometimes Botox, you get the problems when not proper Botox is used. They use veterinary Botox, and they give much higher concentrations than they're supposed to give. So the few reports that have happened have been to Botox that hasn't actually been the proper Botox or FDA-approved Botox. And then also, when they do Botox for other conditions, cerebral palsy kids, they give much higher doses, and that's where Botox can lead to problems.
Okay.
But the amounts we give in cosmetic Botox are like 1/10 of the dose that they give in urology.
Two things there, Maureen. Veterinary Botox, for what is it used on animals?
No clinical trials on Botox. We like very different forms of Botox. That's why you have to make sure that there are two different types of Botox now registered in South Africa. Botox is registered for, on label is registered for frown lines, and off label you can do around the eyes, and then there's a new Botox called Dysport, which is registered for neurological conditions. Those are the two Botox that are registered both here and in the States.
Okay. Do people take out any sort of insurance, nervousness, especially around the face, especially when dealing with, as you describe it, it is a drug? Do people take insurance out before having Botox done?
No. Not that I'm aware of, and I've been doing it for 10 years. No, look, the first time it's just the unknown. As soon as they've had the first treatment, they say, oh my goodness, was that it? They can't believe that it's such an easy procedure, done in the right hands, and and 2 weeks later when they come back, they can't believe that the difference that it's made to the face. Obviously
been very successful for you and all your patients, or clients maybe I should say. You mentioned cerebral palsy there. Is it something that's used a lot cosmetically for people with cerebral palsy? No, not cosmetically, functionally. Like cerebral palsy children and stroke patients can't actually open their hands, or they have spasm in their legs, and that's where you have to give larger doses of Botox to actually release that spasm, so that they can, use their hands, for grooming, for eating. So it's quite a miracle drug in those conditions. And that's just one of the few conditions that are used for Botox. I see, yes. I see that it's also used as a cure for migraine. Now, migraine is something from within. Botox, one has a feeling it's something from without. How does it work for migraine? Migraines, I think it releases the tension, normally for a tension headache, and they say there is some neurotransmission to the brain that they're trying to work out that it actually does improve. There's like a connection between the muscle and the brain. They're still trying to work with that one out, but it definitely reduces the amounts of migraine that one gets in a month. Maureen, who comes to see you? I mean, we've been making assumptions about it being women. Do only women come and see you? And what sort of women, of all cultures, all skin types? All cultures. I mean, we've had mostly women over the age of 35 when they start seeing those first lines appear. Women who get divorced, women who are changing jobs, want to look better for the workplace. Men are slowly filtering in as well. They're realizing, that their wives are looking better, and they see the benefits of Botox. And then also, to look better around the workplace, to have, more relaxed look, and not such an angry look. Vanity, all is vanity. Roughly, how much does it cost? Look, it depends on how many units you inject. So for the frown lines, for a woman, you'd use 20 units for those two lines in the middle, the glabella lines, and that would be approximately 1,000 to 1,200 rand per area. And then for the eyes, you'd use between 900 rand. You need between 15 and 20 units, just depending on how many wrinkles you have and how bad your crow's are. And then obviously how expressive your face is. The more expressive your face, the more Botox you may need. And if you have it done at the age of 30, you get women coming in their early 30s. At the age of 70, what are they going to look like? Will it still be effective? Absolutely, because there are two kinds of muscles, and there are two kinds of trends of Botox. You get the elevator muscles that lift your brow, and then you get the depressor muscles. So if you're younger, your elevator muscles are more active. That's why you look fresher. And then over time, your depressor muscles, which push the whole brow down on the brow and the jawline, they become more active, and that's why you get the brow ptosis, and that's why you get the jowling. So that's why it's important. If you can keep that balance negative, or neutral, then you don't get that hectic dropping of the brow and the jawline that occurs. Well, so in fact, you can improve it after using many years of Botox. You can actually improve what you look like. Okay. Well, let me give out the phone number if anybody would like to be in touch. It's the Skin and Body Renewal. They're operating in Johannesburg, Cape Town and Pretoria if you'd like to get in touch. Contact 0861 Skin SA. That's 0861 Skin SA. Or if your number's sort of a person, it's 0861 268 6972. 0861 268 6972. You're listening to Otherwise.
Otherwise on